Chloe and Kendall are identical twin daughters. They're 18 months old. And at about 12 months, 13 months, they were diagnosed with restrictive cardiomyopathy.
I remember looking at one of the doctors and I kind of asked best case, worst case scenario, and they said heart transplant.
We found out the girls had restrictive cardiomyopathy because Chloe had a stroke. The doctors wanted to find out how that clot made its way to the left side of her brain, so they did an echocardiogram of her heart and found out Chloe specifically had restrictive cardiomyopathy. No fun. Because she's a twin, we wanted her sister tested as well, so Kendall received an echo and confirmed that she had the same heart condition. When I walked into my office, I had a voicemail. It was from the hospital. It was Dr. Kendall saying that they found a donor for Kendall.
Chloe was actually going to be discharged tomorrow. I mean, I don't want to say we're glad we're still in the hospital, but one just getting over surgery and one going in there, I mean, this is the best place to be.
And that's a really rare thing to find two infant twins who have severe heart disease this early. These things are often hard to find.
To be told that two of your kids have a heart condition that there is no other solution other than heart transplant is completely devastating.
The amount of x-rays and blood draws and echoes and caths and feeding tubes and colds and everything that goes involved in being at the hospital and being sick will wear anybody out. And they're happy.
These two little girls don't know how strong they are. They won't ever know because if this is normal to them. It's amazing. It'll be nice to have all five of us in the same house now. We get to go home. It's awesome. It's exciting to go home and be back to our regular life and start our new normal. The day nurses and the night nurses have just become so much a part of your family that it's hard to say goodbye to them. And ever since February, one of us has stayed at the hospital every night. For the whole month of March, Dan and I were both here all day and night.
The girls are both coming in for their heart cath, so they're going to do a biopsy of the new heart, and they'll check for signs of rejection on the cellular level. Kendall will come in later today, and she will have hers done, and then they'll send her to the outpatient. But Chloe, after her cath, will go back to surgery to where she can get this tube pulled out of her nose, and she'll get her gastrostomy tube.
Transplant's a life-altering surgery, obviously, but it's also not a forever treatment. Right now, we know that all transplanted hearts will eventually reject. We hope that with an infant, we can get about 20 to 25 years of function out of that heart.
No one likes a therapy that's predicated on the death of another patient, which transplant is. We need another solution for the organ supply issue. And I think there's possibilities out there, but it's going to require some intensive effort, research monies, and development, but I think it's doable.
We'll follow her really closely still. So we see these kids after their transplant every week or two for several months. She'll get another catheterization again in a couple of weeks. And hopefully that one will be perfectly normal, right? Jeepers.
Everybody here has some sort of struggle and some battle, and that's normal, and that's okay, which is the importance of being part of this family, I think. gives the girls a place in a space where they're gonna be okay.
Everyone is here for your child.
Okay. They saved both of our daughters' lives.
I mean, we're just trying to find a way to pay it forward.
We're relying on somebody else's generosity to make sure your child lives, and that happened, which is awesome.
Every day is just an entire blessing for us.
If we didn't have the Herma Heart Center, it's scary to think of what would have happened to our daughters.